Gabo, are you there?
Yes, I'm here.
Yes,
So,
I'm here.
How many participants do we have so far? We got a good critical mass. Hi everyone. Yeah, this is Olivier and Gabo from the working group, the UpDog working. Another minute. So let's give it our screen. Great. People who just join on, we just give another minute for people to join. We will be starting shortly. Well, now it looks like we have a good 40 participants, and there's that we. Good evening, everyone. My name is Olivier Defau. I'm here with Gabo to present or to facilitate this very exciting webinar that we're going to have. The webinar will start by just a brief overview of the latest on the UAV for payload delivery working group, as well as the TechNet. TechNet is a platform that is joining today because it's focusing on immunization, and because the topic today, especially on the use of drone and the integration of drone into the immunization supply chain, we are co-hosting this webinar with TechNet. I will also briefly introduce drone and the latest on drone in immunization supply chain, a general why are we looking at drone specifically for improving, strengthening, optimizing immunization supply chain. And then we'll have the honor to have Aime from UNICEF, who will be about six months ago, and will be followed by Luciana from VillageReach, who will be presenting about the recent work performed by the team in where actually I am currently. So hopefully the connection is still okay. And we'll finish by a few minutes talking about the operationalization of drone within an existing organization supply chain and the resources that are available to all of you. And then we'll have 30 minutes open to all the attendees to ask questions or ask clarification. So let's move on to the next slide. Gabo, if you can advance the slide. Yeah, great. That way also I know that you can hear me. That's wonderful. Okay, the latest on the UAV for payload delivery working group. Maybe some people are not, because we are co-hosting this with TechNet, some people are maybe less familiar with this working group. So just a word, this is a global network of over 250 stakeholders that are interested directly or indirectly in the development and the application of drone for delivery in the health sector. And the goal of this working group is really to provide value for our members and create a platform where information can be shared to advance the work of all participants and promote partner coordination and potential partnership. And we do that through developing a shared evidence base by hosting webinars like today, by producing monthly newsletters with the latest in the space. We also hosted launch about a month and a half ago, a new website, a new website that contains a library, a resource library with many articles and videos ordered and then posted there, so you can always go back to it, as well as the slides. So this is really a resource that is there for you to really help all of you leverage the knowledge and the experience from each other in order to accelerate the development of drone for delivery in the sector health. And you see on the bottom right, you know, the members really consist of representatives from a wide range of organizations, going from NGOs, implementers, funders, private companies, logistics, academia, UAV manufacturer, governments, academic institutions, and so on and so on. So this is a very exciting. And lastly, we are going to have now a steering committee who are going to be helping with bringing this platform, this working room, to the next another level. We hope another level, and increase the value of this working group and the resource that it provides to all of you. You will hear more about that in the next few weeks. And Dan, I believe you're there. You want to introduce us the TechNet resource forum? Dan, are you there?
So hi, Dan is unfortunately not here. He couldn't come for some personal reasons. So good afternoon, everyone from Geneva, and welcome to this webinar. My name is Alex Pascuto. I'm the TechNet community manager. And sorry, for those who don't know what TechNet is, it's a global network of immunization professionals since 1989, so it's been 30 years. And we commit to strengthening immunization services by sharing knowledge, building relationships and networks, coordinating activities, and aligning priorities and goals. TechNet is managed by WHO and UNICEF, and we focus on cold chain equipment, immunization supply chain and logistics, and immunization service delivery and program management. TechNet is not only a web platform, it's also a conference that is held every 2-3 years. And the next one is next year in 2020. The focus of this conference is to enable immunization professionals to meet and discuss the latest developments in immunization practices and policy. So if you are an immunization professional and if you don't have an account, just come and join us. It's open to everyone from global level, national level, subnational level, regional level. It doesn't matter. We all discuss equally. You can find lots of knowledge and information. You can discuss and network with people. We also offer lots of services. And you can also find us on Twitter, Facebook, and LinkedIn. And we're happy to co-host this webinar. So I hope you learn a lot and have fun, and don't hesitate to ask questions.
Thank you. Thank you. Very, very exciting indeed. Let's move on to the next slide. So I'm going to just give you a couple minutes introduction of why drone in the world of immunization supply chain. Well, resilient and high-performing and efficient immunization supply chains are the basis for a strong primary healthcare system. I think everybody knows that. And yet, immunization program in low and middle-income countries have struggled over the years to match their vaccine demand with constant supply, especially at the last mile, in the last mile environment. Effective and efficient immunization deliveries in many countries, and large-scale infrastructure investment have been slow to progress, especially at the last mile. Next slide. And drone have a very strong potential. Gabo, if you can switch. Next slide. Yes. So drone have a high potential to improve immunization delivery. But we must keep in mind that drones are still a frontier technology. And we're going to see that in the presentation from UNICEF and VillageReach. And I like to compare drones to where trucks were about 70 years ago. This slide is a slide that I keep referring to, where you have an example of subsystem element that needs to be in place for a ground transport, such as trucks, to be operational. And you can see that back in the 40s, when the truck was first introduced, those subsystem elements that are critical for the safe and reliable use of truck to deliver product were still either not up to date, not optimal, not working, or in progress of defining those subsystem elements. But now we would agree that truck are being used on a regular basis, and the system elements are mostly in place. Well, we did a comparison with drone, and really there is some similarities. That's why I like to compare the use of drone as a mode of transportation and carrying goods. Very similar are where the truck were about 70 years ago. Next slide, please. And like I mentioned, so drone integration shows a high potential for optimizing some supply chain challenges, especially at the hard to reach area. But drone implementation may not solve all the supply chain challenges. Their value is most reached as a complementary transportation methods within an existing supply chain system. It's not there to replace, or it's not there to create a new parallel supply chain in a parallel mode of transportation. It's there to complement existing mode of transportation that we use in specific case. And when considering supply chain design, drones have an amazing potential to reduce transportation time and optimize last mile delivery. As immunization product volumes are relatively small, we must ensure that you consider integrating deliveries with other non-immunization commodities to increase the cost efficiency of the drone transport. Also, consider the reverse logistic capabilities of drone, the drone, especially the drone that take off and land vertically, requiring less infrastructure, and the reverse logistic for transporting, for returning laboratory samples or expired product, for example. Drones also have the potential to increase immunization utilization by bringing products closer to facilities on more reliable schedule, and so increasing the equity of access to health product. And health worker efficiency is also one area that show huge potential benefits. By directly delivering drones, by directly delivering product at the facility, health worker can time on logistics, on fetching commodities, and more time serving their communities. Drones also provide a potential mean of communication for facilities with limited, for example, phone services. Health worker can send via drone their requisition, the data collection, the stock report, even the epidemiologic report, and so on, more quickly, optimizing stock level as a result, for example. And finally, drone can be a much faster means for stock replenishment for a routine or for emergency delivery. And I promise this is the last slide that I'm going to talk about before we go to the presenter about the two study case. Although drones have been used for many years in other sectors, agriculture, mining, humanitarian response, for example, for land mapping, search and rescue after a disaster, the use of drone for payload delivery is still very much in the exploratory stage. There are about 40 implementations of drone in the health sector, but very few have moved past the first phase of implementation. And what is this first phase? The first phase is what we call the advocacy and demonstration phase, demonstration testing phase, during which the focus is really on proving the safety, the acceptability and feasibility, and create an enabling environment to promote the use of drone in a specific environment. The next phase is called the ongoing use and validation phase, which drone systems are introduced over time in area with a particular transport challenge. And during phase 2, we continue, of course, to demonstrate, to confirm the safety, acceptability, and feasibility. But as we transport product over a sustained period of time in a small number of sites, we start looking and generate the evidence on the effectiveness and efficiency of drone system and its impact on supply chain performance, cost, on the impact on the overall system, health system in a particular context. And then you have the final phase, that is the expanding impact, which governments and partners expand the geographic use of the drone and the number of community, the type, number of community being transported within the context to maximize impact. And so phase 1 and phase 2 really in the immunization world really are, you can see that there's really very little implementation that have been done. There is the Vanuatu in 2018 that we're going to be hearing about, and the DRC in 2019 that VillageReach just finished the phase 1 a few weeks ago. And then there is an ongoing use in Vanuatu, at least it's about to start, which will fall under the phase 2 definitely. And under phase 3, well, there is of course the zip line, and with its implementation that started in Rwanda in 2016, and then now its expansion in Ghana. But really, today is what we're going to be focusing on is really covering the phase 1 and phase 2 experience for both the DRC and Vanuatu. And I'm very excited to have Jaime present on behalf of the UNICEF team in Vanuatu, but I also know that there is some of his colleagues who's going to be jumping in either during the presentation or the Q&A right after. Jaime, do you want to take over?
Thank you, Olivier. Good morning and good afternoon, good evening to all the audience. Could we go to the next slide, Gabo, please? Okay, let me talk to you very briefly about UNICEF. We are the UN Agency for Children. The organization works in over 190 countries and territories and has spent like the last 70 years working to improve the lives of children and their families. We are an organization that responds like every year to more than 300 humanitarian emergencies, and one of the largest procurer of vaccines in the world. With the vaccines that UNICEF procures, we reach about 45% of the world's children. And in general, the organization has a more or less $6 billion operation, which 90% of those like go directly to programs. Could we go to the next slide? And in achieving our mission for every child, we have the challenge to reach the most vulnerable, these communities that live more than 2 kilometers or more from an accessible road that is like almost 1/7 of the human population. And since like 50% of the world's children relying on vaccines from UNICEF, we have still like 20 million children who do not receive the whole immunization schedule because they live in remote areas. So this is kind of like the challenge that we want like to achieve, to tackle here. Zooming into Vanuatu, the country has a very small population, but it is very dispersed. The country is an archipelago formed of 80 small islands of volcanic origin. It's the size almost of Florida from north to south, like it's 1,600 kilometers. 65 of these islands are inhabited, and there's like a situation in which most of these islands doesn't have like road networks, airstrips, so mostly transportation is done by boat to deliver the supplies. Could we go to the next slides? And this geographical context of Vanuatu poses challenges to service delivery. They have an air transport, antiquated air transport fleet, few suitable airfields, limited roads, and basically the country relies on walking tracks where health workers have to actually hike and during hours to transport some of the medical supplies. So it is in this context where that we will be talking about like the delivery trial, the vaccine delivery trials. Could we go to the next slide, please? So just let me tell you about like what's the situation of immunization in Vanuatu in 2013. In this demographic and health survey vaccine coverage in this survey, we see like Vanuatu was amongst the lowest, has the lowest immunization rate in the Pacific region. So since 2013, UNICEF has been working with the Ministry of Health on micro planning for the extended program in immunization and doing doing a strategy to reach every district and every province. They're having like some progress in the latest survey from 2016 from the one that happened in 2013, but there are still like around 20% of children who miss out on one of like these life-saving immunizations. So there's still like 1 in 5 children in Vanuatu that need to be fully immunized. Could we go to the next one? So how does the immunization service delivery works? Immunization is provided at hospitals, health centers, and health dispensaries. And this is done like through fixed and outreach sessions. So basically, there are like 141 facilities through the island where mothers have to travel to these health facilities and get their children immunized. And this occurs, these sessions occur weekly. And then there are outreach sessions in which teams of health workers will go to remote communities, traveling with the vaccines in containers, in cold chain capable containers from the health centers. And these 8 posts are the ones who are responsible for immunizing children in remote communities. So could we go to the next one? Yes. And so in this one, in this slide, we can see how dispersed is the population and like more or less like what's the target population for each one of these provinces. Vanuatu has 6 provinces, and here's like the 141 health facilities distributed among health centers and dispensaries. We took out like here 2 referral hospitals that are one in Sanma and one in Shefa province and 4 provincial hospitals, because these hospitals mostly deliver the vaccines during at birth. And then like the ones that are most important to reach out are these health centers and dispensaries. So approximately, you can see here that it's like 80, something around like 80 to 155 target children per health facility. And you also see like the global budget from the country to reach each one of those children is around like $170,000. You can see also see like it's mostly rural where like 65% of the population needs to be reached out. Could we go to the next one? So I want to explain a bit about how the immunization supply chain works in Vanuatu. It's basically a pool arrangement in which vaccines are requested by staff at lower level facilities and then dispatched accordingly from distribution centers. In this illustration, you can see like at upper level points at the national level and the provincial level, the EPI is in charge of monitoring the report vaccine use and adjust the dispatch volumes to avoid stockouts at lower level facilities. So the country receives from a regional hub in UNICEF Fiji annually the stock of vaccines at the national vaccine store. And they operate with a 12-month stock and have like a 3-month safety stock. Then from that national level to Port, which is in Port Vila in the capital of Vanuatu, every quarter they distribute to the provincial level, who have like a 3-month stock and 1-month safety. And then at the provincial level, then they distribute at the level where the end user is, which is these 141 health centers that they have like a month stock and 2 weeks safety stock. But like these are like the fixed positions where mothers can go and get vaccinations, but there are also like the aid posts that are not part of this diagram, where they also where health workers actually go to the communities and provide vaccination. In order to facilitate the supply chain, the country also established some island hub storage in some islands that could benefit like other islands that are more far and out of reach from the national level. So they have like this system in which vaccines go from the national to the provincial and then to the service delivery level. And then from this service delivery, from these fixed clinics, there are like, this is like where actually some health workers go and travel for hours to get to remote communities with vaccines for an outreach session. And the project that I'm going to talk to you about looked into the supply chain from the province to the service delivery level, and then from the fixed health centers in the service delivery level to outreach sessions in APOS. So could we go to the next slide? And here is just like an example of how what are the costs to reach children with these immunizations. These costs exclude, like, for example, salaries or the cost of vaccines. It's just around like the cost of reaching every children. And you can see, like, on average for the country, $20 are spent per child to reach them with these vaccines. And most of this, 90%, goes to transportation and DSAs for nurses who have to actually travel from distribution centers to outreach sessions. You can also see, like, for example, in the northern Torba province, the per children outreach cost is around $40, while in Shefa province, like in the province where Port Vila is, where there's like a more concentrated population, the average is around $8. So there's like a great variation here between urban, rural, and this is like the context in which the government wanted to discuss how could we integrate drones into their supply chain. Could we go to the next one? The questions of the rationale for the government to integrate unmanned aircraft systems into their immunization supply chain was around, they wanted to reduce the medical supply costs, but mostly concentrated on having fewer losses, having fewer vaccines that lose potency because of the tropical temperature and what it takes to transport them from one place to the other. They want also to explore how drones could provide a more flexible delivery or redistribution system between distribution centers and health centers and dispensaries. They wanted also like to reduce and explore like if there could be like reductions in cold chain equipment costs at upper levels or at health centers and dispensaries for having this technology and kind of providing an on-demand service for these outreach sessions. And they want also like to explore if drones could provide, make more productive use of the time of the health workers who are in the status quo were the ones like who actually had to transport the vaccines. So instead of transporting the vaccines, maybe they could like be more concentrated on their work with the population. So they would still need to travel to these aid posts, because at these aid posts there's no personnel, there are no health workers trained to administer the immunizations. They would still need to travel to these aid posts, but like they could use that time of traveling and getting there with doing their work for healthcare instead of like just transporting the vaccines. And they want also to explore if like using drones could also help to transport other life-saving medical supplies. Could we go to the next one? So the objectives for the government of Vanuatu to test the use of drones in the expanded program immunization was like if they could actually integrate drones as a last mile resource that could have a supply chain, a more efficient throughput in the supply chain, if it was technically feasible to use drones and integrate into the existing supply chain, if the technology was going to be accepted by local communities. And finally, like what would be the viability of using this technology safely and integrate it safely to Vanuatu's national airspace? So these three questions are the ones that from the government, in which they set up like this project, the vaccine delivery trials, which was led by the Ministry of Health and the Ministry of Infrastructure and Public Utilities, which is the ministry under which the Civil Aviation Authority of Vanuatu is administered. So this project was endorsed in June 1st, 2017 by the cabinet, and it was the cabinet that requested UNICEF to support this project. Could we go back just one slide? Yeah, so like the partners in this project, UNICEF, DFAT, and the Global Fund, and we designed this project in 3 phases. Phase 1 in 2017 was originally a self-funded challenge. Then it evolved like as part of a contract in 2018 and 2019, which basically is an open score challenge. In phase 2, it was mostly an open and public procurement process for 3 tenders to commercially deliver vaccines over 9 weeks in several islands. And phase 3, which is still in the process of design, is the complete integration of drones into their health supply chain. Now, could we go to the next one? And we knew that one very important element was to do community engagement. So here in this picture, like a lot of the community engagement was done related to safety and safety precautions. The team, so like Vanuatu is a country where there are like more than 110 different cultures, languages. So the team was very careful to actually go and visit all the communities, schools, and health facilities that were under the proposed flight paths of the drones. And they engaged with nurses who were responsible of the healthcare, but also with teachers and children, and talking about some of the safety concerns. Don't throw stones to the drones. That when you see a drone like open and be train the nurses of what to do when the drone was going to be landed. And all these discussions were held with community leaders, but also with nurses. And nurses here play a major role in order to work further on with the community. So like since 2000, the project started and actually the flights happened in 2018, but since early 2017, like this work around community engagement was started by the team. Could we go to the next one? Let me just explain very briefly this first phase. It was is designed as a challenge in which the companies should like do 3 score flights through these waypoints and deliver a package with inactivated vaccines. They had to maintain a temperature around 2 and 8 degrees Celsius. Landing at the site was something that the project didn't require, and like the company had to choose like their equipment, their delivery systems, and it was open also like for them to choose like what type of vaccine carrier they were using. So originally this phase, as I mentioned, like was designed as an open, like a self-funded challenge. We received 20 companies who were interested to participate. We selected from those 27 companies. But then when we reached the stage in which we had like to sign a letter of intent for these companies to participate, only one company of them like was able to participate. And mostly in our assessment, it was like the costs related to travel to Vanuatu, which were like something around $20,000 for these companies, and these were like mostly startups. So we went back to the desk and redesigned phase 1. Could we go to the next stage? To the next slide, please. And we redesigned phase 1 to be part of like the contract agreement. So phase 1 took place between December 2018 and January 2019. First, in May 2018, there was this tender period in which Vanuatu government signed contracts with 2 companies. There was like extreme coordination between Ministry of Health, Ministry of Foreign Affairs, and these 2 companies were selected, Supaero and Wingcopter. So basically, there was this scored flight. Both of them passed, and this phase was useful for civil aviation authorities to see like that they had like the technology, and the technology could be used safely. In both companies have issues during this test flight. So for example, Supaero, there was a drone crash in that second day because there was a mismatch in the elevation set for the waypoints. But they ended up passing to phase 2. And Wingcopter had like some problem with the batteries. The batteries didn't arrive on time, and then they have like to also like improve their vaccine carrier to maintain the temperature of the vaccines. But in general, both countries passed like with the score required into phase 2. Could we go to the next slide, please? Phase 2 require like a lot of preparation. So once the companies passed that first stage, they were asked to deliver the monthly demand of vaccines and medical supplies for centers. So we didn't ask like the companies. We asked the companies to come up with a logistic operating procedure to coordinate with Ministry of Health, to coordinate with the Civil Aviation Authority, to keep their fleet always operational, to train their health workers that were going to receive the cargo, and to always keep the temperature between 2 and 8 degrees, and deliver the monthly schedule of vaccines and keep that schedule. So to make that happen, could we just like hit the next button so like the animation appears? One more time. Yeah. So like we have to work with a Civil Aviation Authority to create a regulation. So like the Civil Aviation Authority at the first, the decision was to adopt the New Zealand model, and then like made some adjustments during the trial. Also, like the contract require the contractors to have remote pilot aircraft operator certificate, but they're like, since these are not transnational, so like one operator had like to get again like their remote operator certificate. Also, the Civil Aviation Authority used SORA as a guidance, because just as a guidance for assessing the operations during the phase 1. And the contract also requires some certifications for BBLOS, but none of the companies had a certification for BBLOS. So that's why phase 1 was very important. And there was like a lot of scrutiny during the first flights in phase 2 by Civil Aviation Authority, using the SORA to actually approve and approve the flights. And the companies develop also like these SOPs to somehow like have like a flight, their flights being shared airspace with manned aviation. There was like these note times that were always there was a flight they were emitted by the operators. We go to the next one. Yeah, so like the companies, they have like 2 different logistic operating procedures. So for example, Supaero decided to land the drone at the delivery site, and the nurses were trained to retrieve the payload. So they use a satellite communication link. Their decision to land the drone actually increased the opportunities for community engagement, redistribution, and most importantly, these 2-way deliveries. So their LOP also allowed for having like this kind of scheduled deliveries, on-demand deliveries. Nurses were able to go to schools, for example, randomly count the number of children that they wanted like to immunize, and then like ask for the vaccines through an SMS. They received the vaccines in 20-30 minutes and were able to immunize all children on an on-demand delivery. But as the drone was also used and was actually landing, very quickly the community was also like sending back some of other medicines back to the distribution centers when it was needed. So Supaero LOP allowed for the like 2-way deliveries, and this was very well received by the community. It required much more training and much more work with the nurses, but it was very well received. Could we go to the next one, please? Wingcopter, in contrast, they chose another mechanism. They didn't land the drone. They delivered the payload through a winch mechanism, hovered the drone at around like 10 meters above the delivery site, then dropped the payload. They were using a radio mesh network that needed them to install some relay antennas in mobile telecom towers, plus also a satellite com link like just for safety. So like not landing the drone, like what was in on the benefit side of it, like it allowed to expand more rapidly and more safely the number of delivery sites. The training to nurses was less intensive. They just needed to keep an area clear, and like they could like keep a good communication link with the drone. They also allowed for this LOP also allowed for schedule and on-demand service delivery, but it was only one-way deliveries. It didn't have like this strong community engagement component of where drones could be used like in two-way deliveries. Could we go to the next one? So as I mentioned, like both LOPs allowed for the delivery of other communities, and this was like a very good indicator of like the buy-in from the community of the delivery system. Envelopes, paperwork, syringes, and other medical supplies, medications for epilepsy, post-delivery bleeding, oxytocin, were delivered from distribution centers to health outposts. But also like in this two-way, like also they were redistributing some antibiotics between health dispensaries, malaria tabs, iron supplements, and there was like this two-way mechanism allowed to happen, like a more redistribution between dispensaries and distribution centers. Could we go to the next one, please? And to end, like the results of the drone trials were like basically that the drones, we showed that the drones can safely deliver temperature control medical supplies to last mile communities, having these flights of around 70 kilometers, reducing 5 hours, 6 hours hike to a 25-minute flight. So it was very well received by health workers. During the project, during the 9 weeks of the project, there were like 150 BBLOS flights, around like 35 kilos of medical supplies were delivered. And this allowed to immunize around 1,000 women and children during this 9-week period that otherwise probably we wouldn't be able to immunize them. So there was an increased engagement with also the Ministry of Health and the EPI. Could we go to the next one, please? Just to end my presentation, here are some lessons for phase 3 of this project and other implementation. So from the context of Vanuatu, we saw that the landing system is preferable because addresses both supply streams and creates more engagement with the community. It's, you know, on the safety side, it would require more training and like identifying these landing sites. But in terms of like community engagement and having this two-way stream is very useful. The introduction of drones also like require like some upstream supply chain redesign. Drones in the case of Vanuatu were only used from distribution centers to health centers, and from health centers also to aid posts. But as you have like a more efficiency on the last mile, you need to do also like a redesign on the upstream supply chain from at the provincial level. So that's also a lesson to consider. And as Olivier was mentioning, we also need like to reach sustainability, have a large number of flights to reach that tipping point in which it's more competitive. And how to achieve this is like using drones for multiple products, for the delivery of multiple products, layering up different use cases. So for example, not only using these drones for the delivery, but also like for mapping and other use cases that can reduce cost. So like a drone in the air has like to be, a drone that is there has to be like taken and use it as much as possible. And the final point is like to achieve sustainability, also building local capacity and skills is paramount. So employing local staff for operation and maintenance of drones is critical. In our rough estimates, it's something around like 40 to 60% what requires to be invested for international staff in between accommodation, salaries, etc. And that could be drastically reduced if we have the local capacity and skills to do this. So for my last slide, I just want to share with you what UNICEF is doing now as a result of these lessons. We are about to launch an African drone, the first drone and data academy in Africa, in Malawi, where the idea is actually to empower young people with these skills, prepare youth with education in tech and business, so they can use drones, pilot drones, and be able to provide the necessary skills to use drones at the scale in the delivery of last mile medical supplies. And that would be all from my part. Thank you very much.
Thank you, Jaime, for this nice presentation. Let's switch to the other presentation before we open for question, comments. Luisiana, I believe you're still on.
Yes, I'm on. Can you hear me, Olivier?
Yeah, the microphone is yours.
Okay, thank you, and hello, everyone. Many of you have probably seen the news surrounding the DRC drone flights in August of this year. And today I would like to tell you the story of the journey that VillageReach took in collaboration with the DRC Ministry of Health, Supaero, Gavi, and many other stakeholders together. This is in fact the story of all that it takes to introduce and integrate a brand new technology and potentially a disruptive innovation into the health supply chain. In a country that previously had very limited experience with drones in the agricultural and mining sector, and no experience at all with cargo drones in the medical field. So this particular project took place in DRC, which is one of the largest countries in the world, and specifically in Equator province, which is also a very large area, as you can see on this map. It is about the same size as Malawi and 4 times the size of Rwanda. Because of the size of Equator, the population is largely dispersed in remote rural areas, divided by the Congo River and many other bodies of water and by dense forests. This combined with the state of the roads and telecommunications infrastructure make Equator logistically very challenging. As a result, supply chain performance historically has been poor, with high rates of both stockouts and overstocks of health products. Before VillageReach and the Ministry of Health started the new generation of supply chains initiative in Equator, which is known as NGCA in French, local health center staff from remote areas had to leave their health centers for days at a time to go pick up vaccines and other medical commodities at the health zone offices. Which meant time away from patients and also paying for travel out of pocket. The NGCA initiative involves direct distribution of vaccines, integrated where possible with medicines and other commodities from the EPI main hub or distribution center in Bandaka, the capital of Ecuador, towards the health centers. It also involves training of health personnel and supply chain best practices and immediate data collection and use. However, the long distances and geographical barriers means that the teams distributing the products from the provincial level and collecting data are a week for weeks at a time. And they have to use a combination of transport methods, from jeeps to boats, again to vehicles or motorcycles, and eventually bicycles or on foot, to reach the most remote villages, which can also become expensive quickly. The vast majority of the villages where the products are going to do not have any modern means of communication with the outside world. That means no cell phone towers or internet, making coordination quite difficult. And long distances also mean the cold chain must be ensured for a longer period of time, potentially jeopardizing the quality of the vaccines by the time they arrive at the health centers. NGCA is in the process of scaling up throughout Ecuador with Gavi funds and has already expanded to additional provinces in DRC. So what has been our motivation? Drones that land at the health facilities could provide a more effective and less costly way to implement the NGCA direct distributions in the most remote parts of Ecuador, helping to fill gaps in immunization coverage while also providing an opportunity to more quickly get reports and product receipt forms back by drone. Could we advance to the next slide? As we've seen, medical cargo drones generally have fallen into these phases. Phase 1, to build awareness and conduct demonstration or test flights. Phase 2, to conduct routine medical deliveries by drone over the medium term. And Phase 3, to scale up and expand the impact over the long term. Could we advance? In DRC, we just completed Phase 1 in Equator Province, a project that lasted for about 1 year from late 2018 to late 2019. Since this was the very first experience with cargo drones in DRC, it involved a comprehensive strategy over more than 6 months to understand stakeholder perceptions, engage in dialogue with authorities and communities, and advocate why drones might be a good idea. It took another month and a half from the moment we obtained approvals to import and use the drones in DRC to the moment we conducted the first test flights in country, and then another month and a half to conduct full community sensitizations and the official demonstration flights. For the demonstration flights, the drones flew between the EPI Provincial Vaccine Distribution Center in Bandaka and the Rural Health Center of Wijifake, which was about 40 kilometers away by air. You can see here the flight route that SupaAero developed. It is partially over the Congo River and partially over land, actually dense forest, and thus parallel to the road. Why was Wijifake selected? It is a rural area that is up to 3 hours by road from the town of Bandaka, but the unpaved roads, especially during rains, make it difficult to access. And the villages in the area have no cell phone towers. So in that sense, it is fairly representative of rural areas in Ecuador, and thus ideal for a demonstration site. The goal was to have the drone fly for about 1 week and land at Wijifake, but also supply for other neighboring health areas, with a total population of 47,000, with the immunization products to last them for the usual 2 months plus 1 month of buffer stock. So what were we able to accomplish during this time? Multi-sectoral collaboration, definitely, between the DRC Ministry of Health, Civil Aviation, VillageReach, and SupaAero, among many other stakeholders. We successfully demonstrated the feasibility of utilizing drones for two-way transport of not just immunization products, but also medicines, lab samples, product orders, and reports in hard-to-reach areas of Ecuador. And importantly, we raised awareness and built commitment for scale-up among stakeholders at the national, provincial, local levels, and among health personnel and communities. Next slide, please. A VillageReach and Ministry of Health stakeholder perception study, which we conducted in May, June of this year with more than 100 individuals, showed very little familiarity with drones, especially at the more local levels. So a holistic approach to raising awareness and proving feasibility was needed. We thus had multiple interventions aimed at governance, aviation and health regulations, technology, and acceptability, all of which were equally important to ensure confidence building and also informed decision-making about the supply chain innovation. Next slide, please. So under the governance work stream, VillageReach worked with the Ministry of Health and EPI to establish a multi-sectoral National Drones for Health Commission, and with the governor and administrative and health authorities in Ecuador to establish a provincial drones working group. Each of them held 3 quarterly meetings in 2019 and a joint meeting after the drone flights in August to discuss next steps. These governance bodies received regular updates on the initiative and also provided guidance for implementation. The National Commission, for example, includes representatives from the Secretary General for Health's office, the Minister's Cabinet, EPI, and many other departments, and also from Civil Aviation, Ministry of Interior and Security, etc. Importantly, national, provincial, and local authorities all got directly involved in the drone flights and the project activities. I think it's worth mentioning that VillageReach has a dynamic but very small team in DRC. And the success of all of our projects there has to do with the strong partnership that has been established with the Ministry of Health. This project was no different in that it was a Ministry of Health project implemented by Ministry of Health staff with technical assistance from VillageReach and drone flights conducted by SuperAero. To help the government gain a broader perspective on drone activities and initiatives in the region, we supported learning visits for civil aviation, Ministry of Health, and Ministry of Interior staff. They went to Lake Victoria Challenge in Tanzania in late 2018, and also to Malawi in early 2019 during one of the other VillageReach test flights there. We also worked with the National Drones Commission to develop a go, no-go decision framework for scale-up at the beginning of the project. This had a focus on results and enabled the government to make a formal recommendation at the end of the phase 1 to scale up drone flights in Equateur, as well as a commitment to pursue phase 3 long-term expansion countrywide. Next slide, please. The regulations workstream had to do with both aviation approvals and procedures and Ministry of Health policies and procedures. So on the aviation side, DRC Civil Aviation was involved in the final selection of the drone platform and partner. The full leadership team at Civil Aviation was in attendance at a presentation of SUP's technical specifications in May. And in the absence of national regulations on drones, SuperAero submitted a full documentation package describing their technical performance, safety mechanisms, and also certifications for their drone operators. After reviewing the full package and coordinating with other government agencies, Civil Aviation provided official approval for the importation of drones and their use in connection to our health project. Additionally, Civil Aviation designed application forms that had to be submitted prior to both the initial test flights and later the official demonstration flights. These applications detailed the specific flight plans or routes and other key information, which was also shared with the local air traffic control at Bandaka Airport, because the drone takeoff site at EPI fell within a controlled airspace area in the vicinity of the airport. Civil Aviation sent a delegation to observe both the initial test flights, which took place over 3 days in late June, early July, and the demonstration flights, which took place over 4 days in early August. We believe that the direct participation in the drone flights by Civil Aviation and the in-person exchanges and coordination with SuperAero and air traffic control led to their current commitment for future collaboration. One of the ways, for example, in which we coordinated was by calling air traffic control each day prior to any flights happening, and again at the end of all flight operations, and by providing a tablet and a website where they could follow the flight path in real time. Importantly, we developed an emergency response protocol. This protocol was reviewed each morning by the SUP team lead with a small core team made up of VillageReach, EPI, health center personnel, and even ambulance and police that we had on standby to be prepared for quick deployment if needed. The morning meetings took place in both Bandaka and Wijifake. And we're happy to report that we did not have to put in practice the protocol, as all flight operations were safe and no other incidents occurred. Similarly, a communications protocol was established with the VillageReach coordinator on the ground in Bandaka, sending regular live updates to a broader WhatsApp group that included key individuals from all government agencies that were coordinating the effort. Since cell phone communications between Bandaka and Wijifake were not possible, we had a limited number of satellite phones for the flight crew to coordinate via text message the takeoff and landing times. On the health side, VillageReach worked with the Ministry of Health, especially EPI at both the national and provincial level, on developing brief standard operating procedures for the drone flights. However, these followed the already existing procedures for resupply, transport, and reporting of drone deliveries. For example, for resupply, we calculated the quantities needed at the 5 health centers around Wujifake. We used their average monthly consumption minus the quantity remaining in stock, and we supplied them for 2 months plus 1 month of buffer stock for both vaccines and syringes. And for transport, we utilized standard ice packs to send the vaccines. For reporting, the standard EPI delivery forms were used, filled out by the EPI logistician in Bandaka and the nurse in charge of the health center on the other end, with the forms coming back immediately by drone. Additionally, what we did was to weigh the products for each flight and to also check temperature for the vaccines. We used both an EPI fridge tag and a digital data logger that recorded the temperature inside the payload box continuously during the flights. Next slide, please. Under the acceptability work stream, using our experience in Malawi and Mozambique, VillageReach supported the Ministry of Health in developing a before and after stakeholder perceptions study protocol, which involved focus groups and interviews with more than 100 people at national, provincial, health facility level, and with community leaders and women and men residing in both Bandaka and Wujifake. As mentioned, initially we found a very low level of familiarity with drones, but high acceptability of the idea once we introduced it, with many potential benefits and uses identified in the health field and beyond. All these suggestions and concerns that came out during this perception study informed a multi-pronged community sensitization strategy and public communications campaign. This was conducted over a week before the demonstration flights and included door-to-door education, flyers, posters, banners, radio programs, and press, covering the entire area of operation, while also serving as an invitation to everyone to come and observe the flights. The standard key messages that were developed together with the Ministry of Health staff and community health promoters were later used during these sensitizations. During the demonstration flights, the local health personnel interacted directly with the drone and the community members, ensuring safe landing and takeoff, explaining what was happening, and inviting community members to come and touch the drone at a particular time when it was safe to do so. 7 babies were publicly immunized with drone-delivered vaccines in rural Wujifake. And at the end of all the drone flights on the very last day, we held high-level and local ceremonies that were highly publicized. The ceremony in Bandaka, for example, was organized by the governor's office and saw a strong interministerial delegation from Kinshasa as well, with the Secretary General for Health and the interim governor presiding over and pressing the button to send the drone up in the air. Next slide, please. So a key element to the success of this initial phase of work in DRC was identifying a high-performing drone platform that would also be most appropriate for this particular use case of drones. So in simple words, we needed a drone that could go the distance, literally, that could carry enough product and maintain cold chain conditions, that could fly safely over populated areas, even during rains. They could land at the health centers and ensure two-way transport. That was rugged enough to land anywhere in remote areas, all the while introducing potential cost efficiencies, as in no heavy infrastructure or drone ports needed. So to give ourselves the best chances of success, we issued a global request for proposals, which led to the selection of SUPAERO, and we are grateful to colleagues from Robotics, Cyclops Air, and the DRC Civil Aviation for providing independent experts to support with this rigorous selection process. We also made a conscious decision to conduct initial test flights in Equateur and to split them from the official demonstration flights. Thus, SUPAERO took 2 trips to DRC. During the first one, it took them one day to gain familiarity with the flying environment, to establish connection to satellites, and then they flew for 2 days. 1 day over the Congo River, dummy cargo, and testing safety mechanisms, and 1 day between Bandaka and Mijifake with immunization products. It took weeks of logistical preparations and stakeholder coordination on the ground for the Ministry of Health and VillageReach to then organize the demonstration flights, which took place over several days in August. In terms of operational feasibility, we were happy to see EPI and health center staff quickly take charge of product packaging, loading, unloading, delivery receipt forms, checking product quality, and generally partnering with the SUP flight team to conduct seamless operations. Finally, beyond Equateur, we collaborated with Robotics to conduct a preliminary assessment of both existing and potential local capacity in DRC for future drone operations, maintenance, and repairs. Next slide, please. So here are some of our key results. In addition to 5 preliminary test flights over the Congo River, we conducted 50 flights in populated areas. That's 2,000 total kilometers in the air in 5 days, or 20 flight hours with health products. Each round trip was approximately 20 kilometers. There was no recharging of batteries at the health center, so it was a full round trip before recharging batteries at an average speed of 115 kilometers per hour. This led to significant time savings, depending on how you look at it, one way from 3 hours down to about 23 minutes. But if considering that health workers sometimes have to go pick up the products themselves, you're looking more at 6 hours of combined travel time reduced to about 20 minutes. We transported a total of 25 kilograms of primarily vaccines and syringes delivered for 5 rural health areas to immunize approximately 470 children. And we also, per request from the health center, transported essential medicines and supplies and came back with lab samples. These were blood samples for yellow fever and measles. And also with reports and letters, with the drone doubling up as a cell phone as well. So cold chain was maintained. We proved reverse logistics. There are no safety or product quality concerns. The drones also flew in the rain on one of the days. And 2 drones flew at the same time on opposite routes, proving capability of its scale up. We demonstrated a payload of 2 kgs, but 3 kgs are possible. And the nice thing is that SUPAERO's drones can be 3D printed locally, and design changes can quickly be made. For example, per request from EPI, in August, they already more than doubled the payload volume in preparation for phase 2. And what are our next steps or plans for scale up and integration? So the big question, of course, that everyone is, how do we get now from introduction to integration? So phase 2 is already being planned. Today, a site validation trip has started to many of the remote areas in Equateur province, led by our provincial coordinator in Equateur and the large Ministry of Health team. We're planning 12 months of integrated deliveries. That means primarily immunization products, but also where possible, medicines and other products, to about 25 remote locations. These would be also storage sites for neighboring facilities that do not have refrigeration on site. So we're looking at potentially up to 100 health areas being supplied, and these are truly the most inaccessible areas in Ecuador. So a very large surface area to cover. What are some of our goals? Primarily to strengthen the enabling environment, build local capacity, the data collection that is happening now throughout the province at health facilities, both on the supply chain side and also in terms of gathering exact GPS locations and creating flight routes. All of this will feed into an early effort at system design or redesign at the beginning of the phase 2 in collaboration with the Ministry of Health and EPI. And we are also aiming to quickly obtain flight approvals for all the routes, do the import of a much larger fleet of drones, determine the evaluation strategy, conduct sensitizations. These are all before we're even able to fly. Once we're able to fly, an important goal will be to generate evidence on both performance and costs. We're getting a lot of questions on what will it cost? And at the moment, we're only able, obviously, to provide estimates in the context of DRC. So we do need ongoing operations over a longer period of time to be able to have more accurate costs and a better idea of impact on supply chain performance. And of course, we need to develop a concrete business plan and mechanisms for scale up and sustainability. EPI in DRC is already making plans for a much larger phase 3 that would go beyond Ecuador to additional provinces starting in 2021. And there are discussions at the national level in DRC to expand to additional health commodities, additional settings, for example, urban areas like Kinshasa, and potentially even beyond health commodities. We believe a strong coalition of partners, that is a public-private partnership, will be needed. And in the long term, the phase 3 will allow us to gather data on health and economic impact as well. So I want to leave you with a slide that shows all the institutions and the people that were involved. It really takes a village. We're grateful to everyone who has contributed to the phase 1.
I think you're muted.
Hi, everyone. Can you hear me now?
Yes.
Okay, great. Thank you. Sorry about that. My cell phone stopped working. I'm just going to wrap up with this, leave you with this slide for some operational considerations. And these will also be in the slides that we send out. So I'm just going to quickly forward through so that we can get to the discussion. And lastly, just a couple of resources for those who are looking to integrate drones into their supply chains in the future. All of these resources are available in the UPDWG resource library. And so please visit our website to find out more, or contact the UPDWG coordinators if you have additional questions or would like to be connected with any of the partners at info@updwg.org. So I'm going to turn it over to our panelists, and I'm going to start by asking a couple of questions from the chat. We also have a couple of panelists, other additional panelists joining us, two former UNICEF Vanuatu staff, Ridwan Gustian and Christian Vaquez, and then additional staff from VillageReach in DRC, Dieudonné Niscala, and I believe Moto is also on the line. So thank you, our panelists, and I'm going to go ahead and start with a couple of questions from the chat. First of all, from Ogala, he understands that the benefits about using drones and immunization systems, but one of his questions is if countries alone can take on these efforts, or if a coalition of partners is really needed. So I'll go ahead and open it up to our panelists.
Can I give my opinion on that?
Definitely.
So I think that it's very useful for countries to have a coalition of partners to tackle some of the big questions around the use of drones and how to integrate them into supply chains. There's a lot of things that, a lot of proof of concept projects and a lot of pilots that have been done. And it's relevant, like, to know what it is out there and use the lessons from previous implementations into the design of the particular delivery network that you want, like, to implement. So I think, like, partners are like critical to do that. Also critical to help and work with civil aviation authorities and see what's out there in terms of, like, what would be, like, the regulation that would mostly be effective and a good balance between safety and innovation for that particular country. And I think that's where a lot of the partners who are around, like the World Economic Forum, VillageReach, UNICEF, can help countries.
Anyone on the VillageReach side want to also comment on that?
Gabo, if we have any of our colleagues from Kinshasa, perhaps they could take this question.
Moto, are you on the line to help with some translation for Dieudonné or Freddie? I actually don't see either of them. So maybe Luciana, do you want to help with the translation for Dieudonné?
Yes, Dieudonné, are you there? Okay, perhaps I can just quickly answer and say that I do believe that a coalition of partners is critical. For phase 2, especially in DRC, and for phase 3, the long term, we are looking at what would be the most viable operational models and sustainable business models. And that will likely look like a public-private partnership in collaboration with the drone company, logistics company, government. But what we did learn in phase 1 was extremely crucial. We've learned that such a coalition can work and operate quite seamlessly, and we didn't find many challenges with it.
Great, thanks. And piggybacking off of that, in both contexts, what type of advocacy approaches are in place with these key players to ensure the fast track and the adoption of your next phases? Jaime or Luciana, do you want to jump on that one?
So what type of advocacy, could you just, like, rephrase the question?
Sure, yeah. So I think that it really does take a coalition of partners. What type of advocacy mechanisms or strategies are in place right now to ensure that you move on to the next phase of work?
So if, for example, in the case of Vanuatu, like after wrapping up this second phase, UNICEF is published a report of the whole intervention, showing like the results in terms of like of the technology and how and also like the levels of engagement of the community, and the specific outcomes in terms of benefits for service delivery of vaccines for children. And we have work especially around like I would say like an advocacy of like making the story be well known in different contexts. The case of Vanuatu, for example, made it into like one story in the New York Times, and then was like picked up by different and other very relevant media outlets. So from the I think like that has been like mostly one of like our strategies so far, like making this the outcomes be known, and how like this technology can actually improve that last mile delivery and make it more efficient. So I would say like at the headquarters level, that has been like the strategy for advocacy. Also, we're also going to be presenting this experience in, for example, in Expo 2020 Dubai, for like other countries who would be interested to look into drones and integrating them into their supply chains could continue. And I know like my colleagues in the country office in the Pacific and in Vanuatu are advising currently the government what would be like that next phase 3 for this particular project. But in general, that has been like the strategy for advocacy.
Great, thank you. And someone from the VillageReach team, do you also want to comment on your advocacy strategy?
Sure, I can add, Gabo. I think in DRC, we have now the newly created National Drones for Health Commission, which meets regularly in Kinshasa, and also the Provincial Drones for Health Working Group in Equateur. So these will be the main governance bodies, but also advocacy bodies in a way, moving the work forward. I do think that direct observation of flights and project operations was very useful, and we plan to continue to do that. That means that you have the health technicians involved in everything, the authorities involved, the community members and health facility staff involved. So there is, I think, an important concrete piece of the advocacy puzzle is actually working hand in hand, and the capacity for a local workforce around this potentially new industry, right? I would offer a word of caution, though. I think it has to be balanced advocacy. It is a new technology. It is a small aircraft. Anything can happen. So when we usually introduce projects in countries, we talk about the potential benefits, but also help stakeholders understand the more nuanced aspects of using drones, which in fact translates into having a mini airline transport products in your airspace.
Thanks to both of you. We also have some questions around the operations model. Piggybacking off that a little bit, and maybe you could both speak to what the relationship between the drone provider and the Ministry of Health, or the EPI in particular, was in your trials. So was Swoop doing things like running the mission control, communicating with the manned aviation sector, and things of that sort?
Yeah, so in the case of Vanuatu, like in the contract that was established by the government, they asked for the contractors to actually come up with what would be like their operating procedures, And in those operating procedures, basically, the EPI was in charge of only like doing their job in terms of like the micro planning and like the supply chain distribution at the upper levels of the supply chain. And for the operators, like the contract asked them like to actually coordinate with the Ministry of Health with EPI to get the vaccines from these distribution centers, and they actually do like all the work in the supply chains from that point until like the end of until they actually deliver it to health workers who would administer the vaccine. So the contract also asked the contractors to actually establish the coordination mechanisms with the civil aviation authority. So like, for example, they had to establish each one of them SOPs for flying in shared airspace. Every time they had like to do a flight, they had like to emit a notice to airmen saying like what would be like the flight path of each one of the drones in order to get deconflicted and gain trust with air traffic control in the Civil Aviation Authority of Vanuatu. And this was mostly like gaining trust of the Civil Aviation Authority in this new technology. It was like in the beginning, like a lot the contractors had to work very closely with the Civil Aviation Authority, and as weeks passed, then Civil Aviation Authority started to gain trust about the technology and its capacity to safely deliver the vaccines and fly within shared airspace. But like all this coordination was done by the providers, which also a lesson from this particular project is that most of these companies are also startups, and also they are innovators producing new aircraft, but like they sometimes don't have like all the management or logistics capacity. So it's also like they have like to learn as they go, and like for example, Vanuatu was one of those big lessons and big learnings, not only from the government but also for these companies to actually perform not only the operation of the drones but also like the logistics of the supply chain. And one of the lessons for this project is like in this consortium of partners, when you think of creating this kind of projects, it's always good to not only bring the drone operators but also like some logistics company that could like take responsibility of that whole part, and maybe like being that logistics company the one who establishes the contract agreements with the drone service providers. So like drones could be like as trucks or other modes of transportation. Over.
And in DRC, very similarly, SUPAERO interacted directly with civil aviation. A very nice relationship developed there. They worked together in the field in terms of coordinating the initial and the official study flights. There was direct interaction with local air traffic control, we were housed at the EPI Vaccine Distribution Center in Bandaka, so everything was happening on site, and SUPAERO worked with the EPI and the provincial health division staff for everything from loading, unloading, sending the drones up in the air, positioning the drones. So it was very nice, I think, in terms of the collaboration that happened at all levels. So they're quickly integrated, and I think they won hearts in DRC.
Thanks both. And we only have 2 minutes left, so I will just say I will ask one last question, and then all of the other questions I will submit to the panelists, and I'll get some responses and send those out via email, so your questions will not go unanswered. Excuse me. But switching gears for our last question, a question from Ashley. Since the drones were only carrying immunization products for health facilities that only had a couple weeks of stock, what was the utilization rate of the drones for their payload capacity? And then are you doing anything else to limit drone downtime and to maximize the drone usefulness? Maybe we'll start with VillageReach on this one.
Yeah.
So I think you saw on the evidence generation slide, I think what was accomplished in a very short amount of time. So we're talking more or less 5 days, but really 20 flight hours, right? So maybe half days, if you think about it, was quite impressive. So in 20 flight hours, 50 flights, that's the equivalent of 25 round trips, 25 kgs of products. So we did under the NGCA initiative in Ecuador, health facilities receive 3 months of product. That's 2 months plus 1 of buffer stock. And we did also some of the flights, on at least 4 of the flights, we also supplied essential medicines and came back with lab samples on 1 of the flights. So I think there's quite a lot done, and there was a desire from the health centers to integrate additional products. So for example, the health center in Wijifaque sent a letter by drone, a product requisition form actually, requesting anti-malarials, requesting essential medicines. Some of that was approved by the provincial health director, so we're able to do it. But that is the vision, I think, for the future, is to ensure there is no downtime for the drone, to integrate other health products that make sense. So we're looking at family planning products, HIV, TB, that would be coupled in terms of reverse logistics with coming back with lab samples. Especially anti-malarials, I think, because it is such a frequent, malaria is such a frequent disease in DRC. So definitely the government is already thinking ahead in terms of integration.
Great. And Jaime, do you have any last words on that topic in just a minute or so?
Yeah, I wouldn't have more than that what Luciana already said. Like it's just an issue of, like, for example, with the vaccines, like the vaccine carriers had like to also carry like the ice packs that were like around like one kilo, and like the utilization of the vaccine carriers was maximized in every flight. But like one of the big lessons is just like to layer up like different use cases and also products and the experience in Vanuatu to show that there's demand for that. Like in one of the cases, like even nurses wanted like to get their payments by the drone, and then like from they could like send also their pay slips, so that would reduce time. So there's like a huge demand in terms of like transporting a different kind of products, and I think like that having the demand is there, just like to allow for keep continuously having the drones in the air. So and with more flights you can reach that competitive tipping point. I would just add that.
Wonderful. Thank you so much to our presenters and our and hopefully your next phases of work very soon and hear about your results as well. Thank you, everyone. I will also send out the other chat questions to our panelists and send them out in an email with the slides and a link to the webinars. And this recording and the slides will be available on updog.org in our resource library. Thank you for joining, and we will see you at the next webinar. Thanks, everybody.
Thank you. Bye-bye.
Thank you so much.
Thank you. Bye-bye.
Thank you.
Thank you very much. Bye-bye.
Thank you very much.
Thank you. I really appreciate it. Bye.
Bye.